Okay, we're going to go over the bone markings of the skull itself. So if you look at the skull, what you're doing here is you're looking at the front surface of the skull, namely you can see the facial bones. If we turn the skull here, this is a lateral view of the skull itself. Here is our posterior view of the skull. And then we have here, this would be our inferior view of the skull. So the skull we can divide into the cranial portion and the facial portion. So the cranial vault is where the brain is actually contained. In this we have the frontal bone, which is this green bone right here. This is the frontal bone. It is a singular bone, so you don't need to give a designation right or left. It is a midline bone. So what we mean there is this would be the midline. This the midline goes right down the middle. This crosses the midline. So if it crosses the midline, it's midline. So if we look at the frontal bone, you can actually take off the top of the skull here. And you can see the frontal bone on the bottom side of the skull, like this. You can actually see the frontal bone in pretty much every visual view that we have. You can see the frontal bone. Now moving backwards from the frontal bone, we have two parietal bones. So parietal bone, and on the other side it's a parietal bone. Hold the skull up from posterior view. We have our two parietal bones here. Okay, you have to designate these right and left. You have to designate them right and left. So this would be the left parietal bone. This would be the right parietal bone. What separates the frontal bone from the parietal bones is this joint. Called the coronal suture. What separates the two parietal bones from each other is this joint here called the sagittal suture. Again, you look at the various views, you can see the parietal bones. Take off the top of the skull, you can see it underneath, from the bottom. You have our two parietal bones. From the superior view, you can see the two parietal bones. You can kind of see it from you can definitely see it from a posterior view. And maybe on the sides, on the inferior view, and definitely on the lateral view. And the lateral view is kind of tricky because you have to keep in your mind which side you're looking at when you're actually talking about the parietal bones. Now moving backwards from the parietal bones, posteriorly, we have the occipital bone. It, like the frontal bone, it crosses the midline. It is an individual bone. It is a singular bone. So you don't need to give it a designation of right and left. What separates the parietal bones from the occipital bones is another joint right here. And this is called the lambdoid suture. So you can see the occipital bone in an inferior view. Cannot see it on the, you can see it on the superior view here. And you can definitely see it on the view through the skull there. The last outer cranial vault bone would be the temporal bone. Again, we have one here. Turn it to the other side. We have one here. Okay, so that means there is a right and left designation. So remember the right and left designations. The temporal bone is separated from the parietal bone by a joint. Here, this is called the squamous suture. Another cranial vault bone of note, if we look inside the skull, is this bone right here. This is the sphenoid bone. The marking of note is this marking here, when I'm sticking my pin in. This is called the sella turcica. Now the sphenoid bone is actually quite an interesting bone in the ways you can see it. This is also the sphenoid bone here. Turn it the other side. This is the sphenoid bone here. Then if you look at it straight on, look at the skull straight on, the sphenoid bone actually makes the posterior portion of the orbits itself. That is the sphenoid bone. And those are the cranial vault bones. Now let's look at the facial bones, and the facial bones themselves. Let's move this back. Okay, so this red one here, it's called the maxillary bone. The maxillary bone, or the maxilla. You can call it whatever one you want. Again, it is a midline bone. It crosses the midline. So if you look at it, the maxillary bone actually forms the bottom portion of the orbit, the inferior portion of the orbit, lateral sides of the nose, and the entirety of the upper jaw itself. Laterally to the maxillary bone, you have these guys. These are the zygomas, or the zygomatic bones. The zygomatic bones. These are your cheekbones. These are the ones you can actually squeeze on your face and trace it all the way back. That is the zygoma itself. The other facial bone, if we put it on the skull, is the lower jaw. It's the lower jaw, and that would be the mandible. The mandible makes the lower jaw itself. Okay, so that's frontal view of facial bones. Well, we have one more you really need to look at. And here, actually two more. We have the lacrimal bones. This is a lacrimal bone. And on the other side, we have the lacrimal bone. And then finally, we have the nasal bones. Now, lacrimal bone, and the two nasal bones, these are paired. So you have to give me a designation of right and left. So there is a suture that goes between the two nasal bones that is down the midline. So nasal bone is right and left, as well as the lacrimal bones. Inside of the nose, up in here, we have what's called the ethmoid bone. Most likely I'm going to ask you about the ethmoid bone in relationship to this guy, the cribriform plate, which is a spiky thing, and the crista gallia. Cribriform plate and the crista gallia. Crista gallia and the cribriform plate. Okay. The last bone of note, two last bones of note. One, it is the vomer. It is this orange bone right here, this orange bone. And if you go on the other side, you can see the vomer here as well. It's an orange bone. So basically, it's the nasal septum, the inferior portion of the nasal septum before it gets up to the ethmoid bone. And then we have here this bone. This is the palatine bone. So the maxillary bone, or the maxilla, and the palatine together, they make what's called the hard palate. The hard palate itself. So those are the bones. Those are the bones themselves. So now we're going to talk about processes. So we have, like I said earlier, we have the cribriform plate and the crista gallia. So we've got the crista gallia and the cribriform plate. And what those do is this is where cranial nerve 1 penetrates into the nasal mucosa, allowing you to smell. Then we have the mastoid processes of the temporal bone. That's this projection right here is the mastoid process. So if you look at it on the underside, okay, we have a mastoid process right here. And it's on the temporal bone, mastoid process right here. Okay. This is where the sternocleidomastoid attaches. Okay, and it's the attachment of the sternocleidomastoid muscle. It's right here. And it's only on the temporal bone. Occipital condyles. So you've got to look at the occipital bone, the occipital condyles. And what here is these two rounded projections right here. This is where the first cervical vertebrae attaches. And it allows you to move your head in a forward and backward motion. It allows you to do that with your head. Occipital condyles. The next one I already talked about, the sella turcica, the sphenoid bone. It's right in here. This is the whole sphenoid bone, this yellow guy. Sella turcica. This is where the pituitary gland sits. And then we have the last one that I will hold you responsible for, the zygomatic arch. And that is these arches right here. So if you look at it, you can see the zygomatic arch is actually composed of two bones. It's actually a temporal bone, and there's actually a zygomatic bone component. I'm not going to hold you responsible for knowing that this is the temporal process and this is the zygomatic process. No, you just have to know that this arch and this arch are the zygomatic arches. And again, it is paired. There is a right and then there is a left side. So the last thing we're going to talk about is we're going to talk about the foramens, and depressions. So looking at here, the eye orbit. The eye orbit is very self-explanatory. It's just where the eyeballs go. So this whole structure is the eye orbit. This whole structure is an eye orbit. Again, we have a left and a right. One thing that I do want you to remember, especially on the lecture exam, is what bones actually make up the eye orbit. So if we look at the inferior portion of the eye orbit, it's made of the maxillary bone, and it's made of the zygomatic bone, or zygoma. We look at the lateral portions of the eyeball of the orbit. It's made of the zygomatic bone, zygoma, and a little bit of the frontal bone. The middle portion of the orbit is made of lacrimal bone, maxillary bone, and frontal bone. The superior portion of the orbit is made just of frontal bone itself. And then we have the posterior portion of the orbit, and this is made up of sphenoid bone. Sphenoid bone primarily. So that is the orbit. So looking at the underside of the skull, we have the Foramen Magnum. Foramen Magnum. It's this large hole right here. Okay, this is significant because the brain sits up inside of here. The moment that the medulla oblongata exits from the foramen magnum, it is now spinal cord. And that's the exit of the brain from the skull itself. We tilt our skull this way. On the temporal bone, we have the external auditory meatus. Okay, we have it on both sides. We have an external auditory meatus on both sides. So if we have an external auditory meatus, we also have an internal auditory meatus. And the only way we're going to see that is we have to tilt the skull, look inside the skull. And again, we're on the temporal bone. We are on the temporal bone, both sides. External, here, the pathway comes all the way there. This is internal auditory meatus, that hole right there. Other side, turn it. Internal auditory meatus. Again, you have to let me know if it's left or right. Let's go to the front. So we have to look far in. The orbit itself. This foramina right there that I put the pin into. That is the optic canal. The optic canal, one on each side. Optic canal. And what actually goes to the optic canal is cranial nerve 2. So your eyeball sits in here, and the cranial nerve 2 goes to the optic canal. Now the thing about this is you can see it here, and you can see it here on the sphenoid bone. Then if you turn the sphenoid bone around, you can see the optic canal here, and you can see the optic canal there. So the optic nerves come out here, and they run this way. Then eventually they hit the thalamus, and the radiations go back. And then remember, they cross here as well, next to the pituitary. So that's the optical canal. The next easy one here, if we look at the maxillary bone, so our skull is upside down, you're looking down the skull, you got a foramina here, and you have a foramina here. Those are both called the lacrimal foramen. So the lacrimal foramen, where your tears come out of. That's where your tear ducts come out of. Right? So now we got to look at the underside of the skull. Okay. We have carotid canal, jugular foramen, jugular foramen. Carotid canal, jugular foramen, jugular foramen. Carotid canal, jugular foramen, jugular foramen. Okay, carotid canal here, carotid canal, jugular foramen, jugular foramen. Go inside, follow it up. Can't really see the carotid canal here, but you can see the jugular foramens. Jugular foramens. And that's it. That is the skull. That's everything you're going to be responsible for on the skull.